Great, awesome, thank you. My cat is present, and she's also very ready for this town hall today. So thank you everyone for coming. Good afternoon and welcome to ACYPL's town hall today, where we are going to be discussing tourism and travel in a post-COVID world. If anyone hears my cat, that just reiterates how eager I am myself to get out of the house and start seeing the world again. But we're thinking about post-COVID and what that means. While we may not be able to definitively say when we will be past this global pandemic, we are looking forward to a time when at least some aspects of life will, seem more normal, certainly travel. While many Americans have not even been able to see family in months, others like myself, we've just been cooped up for so long. We have a running list of places we want to go and things we want to do as soon as it is safe. But safety isn't all totality of our concern, because even as vaccines are reaching encouraging numbers, the guidance is remaining the same to wear a mask, socially distance yourself as much as possible, and of course, limit travel. Beyond this, we have to pay attention to how these industries are doing. They've been hit hard financially. Many jobs have been lost, and tourism institutions have varied limitations on when they can open from state to state, according to the type of institution that it is and how much government relief they've received. In the international arena, some countries are ahead of the curve in terms of recovery, and so they are limiting visitors entirely, while other countries, they're operating behind because of this limited supply of vaccine due to global wealth inequality and the complexities of getting all of these vaccines distributed globally. So we're delighted today to have the expertise of 3 ACYPL alumni who will provide some clarity into what we should expect this year and perhaps further down the line. Our 3 panelists are the Executive Vice President of Public Affairs and Policy at the U.S. Travel Association, Ms. Tori Barnes, the President and Chief Executive Officer of the Illinois Hotel and Lodging Association, Mr. Michael Jacobson, and the Vice President of Global Affairs at American Airlines, Mr. Steve Neuman. So thank you all. I'll just go ahead and briefly introduce everyone so that we have a little bit more background. Tori became Executive Vice President of Public Affairs and Policy after serving as Senior Vice President of Global Relations at the U.S. Travel Association. In her current role, she leads the government relations, policy development, communications, marketing, and research teams. She was previously in the General Motors Federal Affairs team for more than 14 years. And before this, she also served as congressional liaison for the Republican National Committee. In 2020, Tori participated in the US-Mexico 360 seminar series, which was ACYPL's inaugural virtual exchange program with the US-Mexico Foundation. So we are very eager to resume our in-person programming here at ACYPL, especially with our closest neighbors in Mexico. It's so close and yet so far in terms of COVID. So we hope that Tori will be part of that as well, hopefully when we can start these in-person exchanges again. Michael has served as President and Chief Executive Officer of the Illinois Hotel and Lodging Association since October 2018, where he has worked on varied and interesting issues, including increasing the lodging per diem for state employees, striking a compromise on the Fair Workweek Ordinance, and working with state legislators to pass legislation protecting hotel employees from sexual harassment and preventing human trafficking in hotels. So very serious subjects. And he was previously at the US Travel Association as well as Senior Director of Industry Relations and Political Engagement. Engagement, he led engagement activities including grassroots advocacy and state-based campaigns. In 2017, he traveled on an ACYPL exchange to Australia, and very importantly, today is his birthday. So thank you so much, Michael, for spending some birthday time with us. Finally, Steve Neuman has worked at American Airlines since 2017 And in his current role as Vice President of Global Affairs, he leads engagement at the federal level with Congress, as well as government affairs at the state and local levels. Recently, a very interesting temporary leave to serve as director for the Midwest region of the Biden for President 2020 presidential campaign. Prior to joining American Airlines, Steve served as a senior advisor for Hillary for America and has other political experience, including chief of staff for Obama for America in North Carolina in the 2008 campaign, and other senior roles in offices of several governors. So he traveled with us, ACYPL Exchange, to Japan in 2014. So again, thank you everyone for making time today to discuss this topic. It is obviously so central to ACYPL's work. And for our audience, whether that's via Zoom or Facebook, I encourage you to pop questions into the chat or post them on Facebook, and we'll try to weave those into the conversation. So just to begin, I think that it would be really helpful. I know that some people, perhaps some people in the audience, and we were just speaking about it before this, are still traveling, be it for work or whatever, but I think for a lot of people, we're unsure of what the status is within this industry. So if each of you could kind of give a brief status update as to the current level of operations within your industries, how low are travel numbers, what practices are in place to ensure the safety of travelers as well as employees. I'd like to begin with you, Tori, if that's okay.
Sure, thanks, and thanks so much for having me here. Clearly, I got the short end of the deal having the virtual Mexico engagement while Steve got to go to Japan and Michael to Australia, but hopefully I'll get to do something fun here. And I think, really grateful for all the work you do to bring young leaders together. Obviously, that is critical, and we need to do more of that in person in the short term. For those of you who don't know, U.S. Travel is the leading trade association representing all sectors of the travel and tourism industry. And here, before the pandemic, we really were focused on growing travel to and within the United States. And now we're focused obviously on the relief recovery, but also looking forward to getting back out and imagining the air travel system, the future of travel mobility, what we can do in the biometric space, and a whole host of other issues that we will be turning our attention to as soon as we get past this short term. The travel industry was the hardest hit industry of all of the pandemic, representing, unfortunately, 39% of all jobs lost as a result of the pandemic in the leisure and hospitality sectors. And that's resulted in $530 billion in cumulative loss for the U.S. travel economy through January 2021. Additionally, that's a loss in $68.6 billion in local, state, and federal tax revenue. And travel spending, even this January, measured 40% below last year's levels for the second consecutive month, resulting in almost 37 billion compared to January of 2020. Generally, overall, TSA screenings were 59% lower this February, year over year. Hotel bookings nationally in April 2021 are looking at 60% below last year's levels. And business travel spending, both domestically and internationally, fell by 70%. So, and I should also note that visits from overseas travelers were down 81% last year. So the whole of the industry has really been really negatively impacted. And I'll let my colleagues here dive into their individual sectors.
Yeah, that is a sad picture to hear about. Steve, what is your perspective? What restrictions are in place on flying? And, I assume the numbers look the same for American Airlines.
Yeah, thank you for the kind introduction. And let me just say at the outset, there was one element of my background that you didn't mention that is particularly timely this week. Before I did Hillary in 2016, I was the chief of staff to governor of Rhode Island, which I note is timely because just yesterday she was confirmed as the next U.S. Secretary of Commerce. So I'm super excited about that. And you know, as I was telling everybody yesterday, happy Gina Raimondo Day to everyone who celebrates. So a big shout out to my former boss, whom I'm very proud of. But anyway, I think Tori touched on it great and really laid out in stark terms, you know, just how devastating the pandemic has been on travel. And she talked about the TSA throughput numbers. And you know, certainly American is experiencing that in a very significant way. And when you think about the U.S. Airlines, American, Delta, and United are the ones that really have a big, strong mix of international and domestic. The other carriers tend to be, you know, not exclusively, but much more focused on domestic travel than we are. And as Tori laid out, the international travel has been hurt even more than domestic travel. And so, you know, to the extent that you know, a larger share of our business is international, you know, we have been, American and Delta and United have been hurt just a little more and hit a little bit harder than our competitors who focus exclusively on or almost exclusively on the domestic side. But as she said, things are terrible. And you know, in the teeth of the pandemic, right at the outset, we were losing you know, $100 million a day, and you know, through some really significant efforts to right-size our costs, as well as, you know, a little bit of bounce back on the booking side. You know, we're down to losing $30 million a day. So, you know, certainly not any place that's a sustainable spot for a business, but, you know, we do see some, you know, light at the end of the tunnel. We are seeing some very modest but noticeable upticks in bookings in recent days, and, you know, certainly on the domestic side. And, you know, we're hopeful that as the vaccine distribution continues to ramp up and accelerate, and more people get vaccine in their arms, that we'll see those trends continue and accelerate. So it's been really, really bad, and hopefully we're very near an inflection point where, you know, it starts to be not so terrible.
Absolutely, yes, hopefully. All of us are there with you thinking about that. So, Michael, is it a similar situation as far as Illinois hotels? Numbers must be down. Are they restricting capacity at all? And has there been, you know, effects that perhaps aren't as nationally known?
Yeah, I think kind of a chorus of voices all saying how bad it has been. In the same cases here in Illinois, where we have hundreds and hundreds of hotel owners that are just struggling to fend off foreclosure of their hotel properties. And so I think looking forward, there's a dim light at the end of the tunnel, but it's a very dim light, and it's going to be anywhere from 4 to 5 year process to get to the end of that tunnel. In terms of is the government restricting who comes in and out of our hotels? Not necessarily for guests. From the beginning of the pandemic, we've been deemed as an essential industry. And if you look at the populations of people staying in our hotels, some of our key demographics or key populations of people staying right now are National Guard members that have been mobilized throughout the state to either deal with the pandemic response or right now with vaccination pop-ups that have happened throughout the state. Some of our hotels are even the site of their county health department vaccination clinics, but also traveling medical staff. And then even in some cases, COVID positive, people that have been diagnosed as COVID positive, but who might live at a multi-generational home and might not want to go home and potentially expose their parents or grandparents who are older and more vulnerable to the virus. So it's been interesting seeing who is staying in our hotels. Obviously, that doesn't make up for the dramatic drop in business. The occupancy rate in Chicago is still at 15%. And anything less than 50% means that hotel is losing money. So it's going to take quite some time till we get back to our pre-pandemic levels. And the question becomes just how long can these hotel owners hold on and survive while we wait for that recovery? And the last thing I'll mention, kind of piggybacking off of Steve's insights around looking at booking data, especially recently, is we do know that leisure travel is going to be the first segment to come back. And here in Chicago and throughout the state of Illinois, while that's good news, we'll take any business we can in terms of increased bookings. In Chicago in particular, we are so reliant on business travel, but particularly meetings and conventions. And that's going to be one of the last segments to come back. And so while leisure travelers will kind of be a nice stopgap in the interim and kind of start us on the path towards recovery, I think that some of the major markets throughout the country, like Chicago, that are more reliant on conventions, are going to probably have a more prolonged recovery, just because we know that that important segment for us, which makes up half of our total revenue, is going to be the last to recover.
I want to underscore the point that the birthday boy just made, and that is that you know, business travel is certainly, you know, we think going to come back slower and later than leisure travel, and that is super important for us. You know, like Michael, you know, just really important segments of our revenue base come from business travel, and so, you know, I mentioned before the Commerce Secretary, and so I do think that at some point policymakers may need to look at whether it makes sense to provide incentives for businesses to get back to travel. You know, here we are in this virtual space right now, and you know, lots of businesses have gotten very reliant on conducting business virtually, whether via Zoom or WebEx or Microsoft Teams or what have you. And you know, I think there's lots of folks who are itching to get back in person and do deals across the table and have a handshake, and you know, to the extent we ever get back to shaking hands, you know, have a beer or whatever it is. But I do think that the business travel is so important for the airlines, for the hotels, and for the economy writ large, that policymakers may need to begin to grapple with, you know, how do we ensure that businesses do return. And I think the first piece is making sure that the economy is in a situation where, you know, that's not an impediment, where, you know, businesses are not worried about their bottom line. And, you know, certainly we're supportive of President Biden and the American Recovery Plan, Rescue Plan, and think that that's going to be important in trying to stabilize the economy, which again is necessary but not necessarily sufficient in order to bring business travel back.
Yeah, and I think, and I hate to jump in here too, but I do think it's important to emphasize again what Michael and Steve both just said. We're doing a lot of work right now and putting together a plan in place to try to compel the CDC and public health officials and then governors across the country that you can differentiate between professional meetings and events and the gathering limitations associated with those vis-a-vis mass gatherings, which are definitely a less controlled type of get together. And I think as we start to see, especially, you know, the great news that the President Biden announced on the vaccine being available for all, you know, adults within the United States by the end of May, that's yet another important layer to the already very healthy and safe practices that travel businesses have put forward across all business sectors in the travel industry to ensure that we are building confidence among our customers, but also to ensure that the public health officials and elected officials understand that there are economic consequences, and there are ways, if you use this layered and safe approach, that you can get back out there and do some of these more normalized things. And again, mask wearing is a critical component of that. You know, the sanitation, the physical distancing. But as my boss likes to say, 200 people in a phone booth is different than 200 people in a convention center. And overall, you know, the overall state and health of the economy will significantly suffer if we don't bring travel back. I mean, right now we're looking at that 2025 time horizon. As Michael noted, in some areas that could be even more prolonged if we don't do things that we can to stabilize the economy. And travel was 1 in 10 jobs pre-pandemic. So, you know, we have a real opportunity to shorten that recovery time period as well.
Yeah, and that brings up
Natalie, can I add one more thing in, because I think it's relevant to ACYPL's mission, and I think Steve touched on this, but I think it's important to reiterate. While business travel is going to take the longest to recover, it's going to recover. A lot of people are saying, is this the death of business travel or conventions? And has Zoom replaced it? And we've had that conversation before, after 2001, after 2008, when travel budgets got cut, or after 9/11, when travel was on a halt. Obviously, we didn't have Zoom back then, but we had conference calls and we had phones, and the same argument was made then. And not, I mean, again, look at ACYPL's mission, and I'm sure Tori can attest to this. Like, I'm sure while the Zoom experience with her exchange was certainly beneficial, it obviously can't replace going to a country and being able to experience that exchange in person. So I think just kind of putting a myth to rest, and you see all these articles and writing about, is this the death of business travel? It's not. It's going to take some time to recover, but nothing replaces being in the room, especially if you're trying to make a deal or perform diplomatic missions. Nothing's going to ever replace that.
Yeah. And that brings up, what all of you were talking about, especially Tori. I'm just curious, the information that Americans have gotten over the past year has been kind of all over the place, as far as from the CDC, but understandably so, because we're all learning as this has gone on. So what has it been like for the tourism and travel industry to take in this information from institutions like the CDC, relay it to employees, and then also try to bring it to the clientele? Because of course, a lot of us have seen these videos and things like that, and it's very difficult for these workers, these employees that are, already at risk, and then dealing with people that perhaps aren't following the same guidelines. What has that been like? And then on the other side, I was curious, to what degree is it a two-way conversation? Because you all are the ones that know best how these businesses are operating. Certainly, as you mentioned, different categories of who is traveling and capacity and things like that. So, how much of it has been a two-way conversation between your organizations and places like the CDC or other government officials on safety? Steve or Tori, you can start.
It's all an important topic, and thanks for raising it. I think there's definitely been a fair amount of confusion and uncertainty. Part of that, as to give my friends in CDC and other organizations, to cut them some slack. The science was developing. There were questions along the way about different things, and so that was a challenge. But there's definitely been a lot of fear that is circulated. That may be overwrought, and certainly from our perspective, when we talk about the airplane experience, we've used really enhanced cleaning techniques for the airplanes. We've brought in HEPA filters that are hospital grade for almost every commercial airplane out there, and so even there was a Harvard study conducted in October, that really talked about just how safe the air travel experience is, and so. From our perspective, that's been really important to communicate about with policymakers, with customers, with our team members, because there's as we said, there's just a tremendous amount of fear out there, and I think there's nothing better to address fear than data and information and facts, and a lot of the facts out there, do suggest that while it's important to be careful, it's important to wear masks. It's important to wash your hands. It's important to socially distance where possible. There are safe ways to move about and move about the country. And we certainly think that air travel, with the masks that we've been mandating for a long time, and that President Biden, put into federal law when he after he got inaugurated, we certainly think that air travel is a place that's really safe, and that's a story that we've absolutely shared not only with Congress and with regulators, but with the scientific community and CDC.
Yeah, and I would say from the broader industry, we put together health and safety guidance back in May with over 30 different organizations, including the American Hotel and Lodging Association on the federal level, and Americans for Airlines for America with the airline industry, and many others in all the sectors. And part of that was always a healthy or a phased and layered approach to health and safety, which is something that we've also touted through our Travel Confidently campaign, again, throughout the whole of the past year. And we really, long before, just like American Airlines, long before the mask mandate, we were strongly urging folks to wear a mask and really emphasize the social responsibility that every individual has in the whole of the travel ecosystem, but not just in the ecosystem. Everything froze up for a minute, so I might have missed it, but there was, an important Harvard study that really emphasized as well, that flying on an airplane could be, just as or more safe than going to a grocery store, quite frankly, as long as you had masks in place. And so we think that the President Biden going that extra step to mandate it in all federal spaces and on airlines, so that folks that aren't following the rules must do so, it is an important step to, again, that building that confidence.
Yeah, and Tori, I have another question. Just since the client or the membership of the U.S. Travel Association is so varied and diverse, what has it been like? Has it been better for tourism operations that are like outdoors, like say golfing and things like that? So what has that been like to manage, the expectations and the needs of these varying members that some of them, of course, had to close down immediately? I'm talking like concert venues and things like that versus these supposedly safer ones. Is there other things that we as Americans can do to try to support our local tourism, for instance?
Yeah, I mean, I definitely would recommend supporting the local tourism. And I think there has been a differentiation across the sectors. Also in the first, the CARES Act, which was passed last March, then the very little help between March and December when you had the next COVID relief package. There were a lot of businesses, just because of this type of structure that they were, or the size of structure or business that they were not eligible for certain help in the CARES Act. And that was a significant challenge as well, because if you think, of certain businesses that can't gather, or even if it's, a wedding venue that's in Maine that only has, a 6 or 8 week, time for the whole year of really like when they really are able to make their money, versus, a business in, a ski destination that, had other challenges, or a beach destination, or something that just isn't one of those outside types of venues. You really do see a differentiation. Destination marketing organizations, for example, that are critical to driving demand in local communities across the country, because they're structured as 501c6s, nonprofits, they were eligible for, almost no relief in the CARES Act. We finally got them some significant help in the COVID relief package at the end of December. But even some of the strings attached to the other programs that were included were much too much for even bigger businesses or medium-sized businesses, which really there was not a lot of help for at all. So yes, we are seeing that the folks want to go to those outside destinations, that they are, have been performing better. But if you look at a hotel in some of those destinations, like, we talked about here around the importance of business travel, they might have been closed for the first 3 to 4 to 5 months, even if you are, a beach destination in some great location. But now, or maybe even it's the start of, maybe the fall of last year, they were open over the weekend, but not Monday through Thursday in any kind of robust fashion. So they're down staff. That's jobs. I mean, I noted, we lost 4 million jobs in the leisure and hospitality sector just last year. And so when you think about that, there's still a lot of work to do.
Absolutely. And so then I'd like to ask Michael, since you're state-based, what has the relief been like for the Hotel and Lodging Association? Did federal or state relief come soon enough? Who makes up this organization, and has there been also varied experiences across regarding how big they are or whatever?
Yeah, I think specific to direct relief that's been provided, Tori mentioned that obviously PPP was a lifeline for many hoteliers. Did it come fast enough? Was it enough? No. Is there going to be more support needed, especially for some of the larger hotels who are on the hook for millions of dollars of back payments and mortgages and property taxes? Absolutely. What I think has been most frustrating is that since the beginning of the pandemic, again, don't read too much into the politics of this, but I think we can all agree that, and partly to their own credit, that nobody knew how to deal with the pandemic. There was no playbook on how to deal with a modern day pandemic, but the lack of federal strategy and planning, I think, caused a lot of states just to take it on their own. And I think that's what's gone into a lot of the confusion as well as frustration, is that every state's handling this differently, and the state rules and regulations are evolving by the day. So I think if you have a hotelier in Illinois, whether it's in terms of what support they've gotten from the state of Illinois or the restrictions currently in place in the state of Illinois, but then they see hotels in our neighboring states like Wisconsin, Indiana, Missouri, then you look down towards like Florida, Texas, Georgia. There's so much frustration of A, their hotels got a lot more support from their government, and B, they've started to ease the restrictions far more. I think looking forward, the biggest thing I would say is that we know much more about the virus and the pandemic now that we're a year into this. Obviously, with President Biden's announcement this week of the end of May vaccination target to get all adults vaccinated, there is that light at the end of the tunnel. I think the planning and the strategy needs to be far less day-to-day of a response and far more long-term and strategic. And I think that will go a long way into at least just reducing the confusion and having the kind of the same set of rules and the same response, regardless of where you are in the country. Because I think what you've started to see is a lot of politics play into it rather than true pandemic response and policy playing a role in it.
Definitely. And just on that note, Steve, what is it like for American Airlines, where you are operating all over the place, all over the country, and then of course, in ordinary times, more often internationally as well? What are you advocating for, in terms of relief, and what has been learned, do you think, by these big organizations of what can we expect if another disaster like this hits? Can we rely on the government to not only provide relief, but even guidance?
Well, Michael touched on it correctly, which is that the patchwork of different rules and regulations has been, a significant challenge. And, certain states having quarantine periods for people who would land, and does that apply to crew? And, so there were all sorts of challenges associated with, a patchwork of rules going on state by state. And then you layer on, the challenges associated with international travel. And, we used funneling airports insofar as there were going to be, people coming in from foreign destinations. They were all going to have to funnel in to one of a handful of airports around the country. That, of course, poses challenges to our operation and otherwise. And then, late in the Trump administration, the president imposed a testing requirement, that you would have to demonstrate that you've had a negative COVID test within 72 hours of getting on an international flight bound for the U.S. We supported that, but it's as with anything in the airline business, it's more complicated than you think to try and implement it, and it imposes, a handful of challenges. So there's no doubt that all of these different layers of policy making from the federal government, from our international partners, and from different states has been a material challenge that we've had to navigate, and certainly tremendous time and resources at the company associated with complying with those and doing our best to keep up with what we're doing. The other side of your question was on the support side, and certainly we've been very grateful to Congress for enacting the payroll support program in terms of as part of the CARES Act, just about 1 year ago. That has been an absolute lifeline for our team members and their families, in exchange for significant resources and assistance from the government. We made a number of promises. Most important was that we wouldn't make any furloughs or involuntarily separate anybody from their employment while we were in receipt of the funds. And then there were, significant other commitments along the lines of executive compensation and stock buybacks and dividends and things like that. So Congress extended the payroll support program in December, and there's a provision in the bill that's currently before the Congress now, could be coming from the Senate as early as today, the American Rescue Plan that would extend that payroll support program yet again. So it's a, obviously that we've just been, sort of flat on our backs by the gutting of demand for air travel and the assistance that Congress has provided twice, and now possibly, fingers crossed, the third time, has been, just as meaningful as can be, and especially in terms of being able to keep our workforce intact.
Thanks. And I'd like to turn now to the vaccine rollout and future projections, because I think when we're speaking about the light at the end of the tunnel, this is what has given us that, is this idea that obviously we are really going to get past this thanks to these scientists that have really come together so fast to make these solutions. And so I'd like to turn to Michael. Where are hotel employees, where are they on the vaccine rollout? Are they getting vaccinated quickly, and what are the protections in place for them?
So speaking of a patchwork of different regulations and rules, every state and even every county has their own ability to judge who's in what group. Here in Illinois, we have phase 1A, 1B, 1B+, 1C, and then 2. It's like, who thought of the naming conventions of all these different phases? And so what you have is, to answer your question on hotel workers, we don't even know clarity because they haven't announced who's formally going to be in 1C. Currently, we're in phase 1B+. And we were originally advocating for hotel workers to be in phase 1B because of the risk. A hotel housekeeper obviously can't work from home. The ones that aren't laid off, that are still working, are going into the workplace and actually entering people's rooms that are living practically in those rooms. And so we were advocating for that, but we've been told no on 1B, and we don't know for a fact if we'll be in 1C. It looks promising, especially because the CDC about 3 weeks ago did announce that they have made their change in terms of federal recommendations, not rules, but recommendations to include hotel workers in 1C. But I think more importantly, just another example of how the tourism and hospitality industry supports our local communities. Even more so than just propping up our local economies. We have multiple hotel sites across the state of Illinois that are partnering with their county health department and serving as their vaccination sites. You look at a structure of a hotel and we have large ballrooms, we have giant refrigeration systems and units that are typically filled with food and beverage for banquets, but are now empty, and we have large parking lots. And so it just makes up for a naturally fit facility to serve as a vaccination site. But I think just most importantly on our industry, looking in terms of the fact that every American will have access to the vaccine by the end of May is incredibly encouraging in terms of getting people the confidence to get back on the road and traveling again. And I think that will start opening the floodgates in terms of pent-up demand. I know we all agree that we're sick of working from home and sitting in our homes, and we want to get on a plane and travel and see our family and friends. The thing thing that is yet to be determined is what percentage of the population is going to definitively get the vaccine. And I think that's a wild card still. We know in our industry, in Illinois, 63% of our workforce in hotels are minority, are people of color. And we know, based on surveys of our employees, especially in some of those Black and brown communities, that there is some hesitancy around the vaccine. And that they're not the only communities by any means, but there is, based on survey data we've gotten back from our employees, some hesitancy. And so we've undertaken, and I think this is an important role of not just the travel industry and every employer, convincing our employees that it's safe, based on recommendations of health experts, thousands of health experts across the world, and that it's an important step to take to get our economy back rolling and just our world back to normal. And I think that's something we're really embarking on here in Illinois, and I think is critical for every employer, of trying to work with your employees to convince them that this is the right thing to do, because unless we get a critical mass vaccinated, it doesn't matter how much supply there is, we need people to get the vaccine.
That's really interesting that you brought up kind of working with the government as well. So not just ensuring that people are getting the vaccine in your industry, but also partnering with the government so that we all get through this. And I'm wondering, Tori, what is the perspective from the U.S. Travel Association? Have there also been instances of working with the government to try to get these policies moving?
Yeah, I mean, I think much like what's been said before, the patchwork approach that we started with from a federal standpoint, I think created some challenges along the way. I mean, now we have this patchwork approach on gathering limitations and all kinds of other challenges as how testing capabilities are in different states. In some states you can't get a test quickly if you wanted to, unless you have symptoms. Well, that doesn't help with the asymptomatic issue. And furthermore, on the vaccine distribution, I mean, I live in Washington, D.C., and I'm not in the right zip code apparently to get the vaccine. So they're prioritizing over 65 right now. That is totally fine in those with medical conditions. But if you live in Ward 6, which is where I live, and you are over 65 and have a health condition, it still doesn't matter. You're not eligible. And I think that we need, as it's been noted here, to have that federalized leadership. And I think we are seeing much more of that in this current administration, and are communicating very much with and engaging with the Biden administration on how we can, as an industry, be helpful to this rollout. I mean, we are seeing, as far as the vaccine, we've got sports arenas and convention centers and Disneyland, where you've got huge vaccination sites. And so that's way that we're partnering with some state and local folks. But we need to have this continued enhanced federal leadership. And then as an industry, we will continue to highly encourage folks to get the vaccine. But we need to make sure that we continue to have that consistent message at the top. I think Michael probably, or maybe Steve, both of you probably noted before, that the mixed messages that we're seeing both in the media and from different states and localities vis-a-vis the federal messaging is not helpful. We need to all kind of be on the same, let's just state the facts here and follow. We all want to get this behind us, and unless folks kind of are willing to kind of follow the rules, if you will, then that's the fastest way we're going to get back to a more normal life where we can be with our friends and family and travel more frequently in the short term.
Right. And just Steve, same question quickly on airline workers and the vaccine, because if we're going state by state, how is that working for making sure that they are protected? And then a second question, just I've heard a lot, and I think a lot of people have read about the idea of these vaccine passports, or some sort of proof before you can travel, or maybe perhaps just certain countries will institute this. So what is your perspective on those two things?
Yeah, well, let me start on the vaccine. It's a huge priority for the leadership of the company to try and make sure that our team members have easy and expedited and efficient access to the vaccine, and we are just devoting a tremendous amount of time and resources on the government affairs side, on our people and benefits side, and otherwise to try and enhance just that. And I'm glad to say that starting tomorrow, we're going to be vaccinating our team members in O'Hare. We're grateful to Mayor Lightfoot and her team in the city of Chicago, and so we've got access to some vaccine in Chicago, and so that is a great sort of first step there, and we're certainly working closely with governors and mayors and county executives. As it's been talked about already, it's a real the vaccines is a major sort of patchwork approach, and so we're working with mayors and county executives and governors all over the country to try and make sure that there's access for our team members. We don't want to jump ahead of healthcare workers. We don't want to jump ahead of people who are old and have underlying conditions and the like. But when it's appropriate for critical infrastructure workers like our team members, we want to make sure that we're moving quickly and making it as easy as possible, and certainly doing everything we can to convince our team members that the vaccines are safe, and that everybody should get vaccinated. To your second point about the the health passport, this is an issue that's important, both internationally. I talked earlier about an international requirement that you have a negative COVID test 72 hours before an international flight inbound for the US. It's also an issue in certain places. Hawaii is one that comes to mind. And so, I think at this point, we've been working with a company called Verifly. I know that some others are working with other vendors on similar ideas, and so I do think that, this is important both to make things easy for our customers who want to travel and to make things as efficient as possible for the jurisdictions that we're leaving from and landing in, to make things go as quickly as possible. So it's something that we're focused on, and want to just make sure there's some standards so that we all know what the rules are and what passes muster.
And I think on that point, the standards is really important. And we're kind of calling them more like digital health credentials, or, obviously the Verifly is a great option. There are a whole handful, I think there's 32 or something different platforms out there. I think a simple secure identity verification is really critical, and making sure that there is that privacy component to it, and strong protections on personal data are really important. But I think, and I think interoperability across jurisdictions, so that, it can be used in an airplane, it can be used in a hotel if the hotel chooses. I think one of the issues, though, that is really important on this, and this is, I just pause on and use the word digital health credentials or what have you, is, the word passport, and I know there are a lot of references to it, is a requirement to fly internationally, right? You have to have a passport. So I think one of the things we need to think about as well is, we don't want this to be a requirement to fly. We want it to be something that helps to enable a better process, a quicker process, and can help especially those that have to kind of take a look at it, so that if an airline needs to verify something, that it's not a cumbersome process. But at the same time, we don't want there to be a requirement to test to fly domestically, and we don't want there to be a requirement to have a vaccine to fly domestically. And so those are kind of important components to some of the work being done in that arena.
Yeah, and that leads me to ask, I think, Steve, you'd be able to answer this. We had a question from the audience about quarantining abroad. And, given that American Airlines obviously does operate internationally, do you have any insight into, say we really do hit this miracle mark in May that most Americans are either planning to get the vaccine or have already gotten it? Do we still think that there will be this, international hesitancy to let Americans in, or at least to require us to quarantine before we take our vacations, or be it business, whatever it is?
Well, we're certainly working aggressively to make sure that the different rules and regulations keep up with the conditions on the ground, and that, again, insofar as, for example, there's robust testing, we think that certainly changes the dynamics from a quarantining perspective, and we're certainly working aggressively with our government partners on that, and we certainly think the same is true from the vaccine standpoint. And so, I think it's like everything else we've been talking about for this entire session, that there are lots of different rules and different overlays, and so it's not a one simple answer where you get one different, one government to make one decision. There's sort of lots of different moving pieces, but I think there's a robust effort in place from the airlines, from U.S. travel and other entities, to try and make sure that there's a thoughtful approach that is taking into account, more robust testing, more robust and vaccinations. And I do, by the way, think that the health credentialing, the digital credentialing, is going to play an important role in that. So, it's certainly my hope, but we've got, some wood left to chop.
absolutely. And then another question that is also very interesting to myself, in recent decades, travel and tourism and vacations have actually become much more accessible in terms of cost for young people, for students. And so after this, with these industries that have been struggling for so long, how can you recover and still perhaps encourage, young people and students to travel? Because, it is obviously a popular thing for us to do when we don't have families and obligations and things like that. We're eager to get moving. So I want to turn to Michael, because I am curious about the situation with hotels and how do you have any idea of how businesses like Airbnb will affect this as well in terms of cost and the future post-COVID?
Well, I mean, obviously, one of the biggest barriers to young people traveling typically is cost, and that's certainly not an issue right now. I mean, if you take the proper steps and you travel safely, which of course U.S. travel and many other industries has those guidelines and recommendations in place, and of course a lot of cities and states have that in law. It can be done safely, and especially as the pace of vaccination picks up. I know my parents luckily just got their second dose 2 weeks ago, and the first thing they did when they came home said, "We want to book a trip somewhere." And obviously, the time to do that is right now, especially as you get vaccinated, because there are some incredible deals out there. I mean, if you're looking to take a cruise, obviously there's no cruise ship sailing right now, but when they start resuming, or obviously airlines are flying right now, there's some. I just looked at this morning. I could go from Chicago to Orlando for $80 round trip. I could never do that a year ago. I was actually on a plane a year ago flying to Tampa. And trust me, it was a lot more than $80 to fly down there. So I think you're going to see a lot of youth when they feel safe to do so, take advantage of a lot of these deals. And they don't even need to be long distance deals. We're seeing a lot of people, because they feel stir crazy, planning staycations, or planning not necessarily staycations in Chicago, but instead of necessarily getting on a plane, they might get in their car and drive 60 miles down the road and explore their own backyard. And I think you'll start to see a lot more of that kind of more regional approach to traveling as well, of, oh, you know what, I've never seen that town that's 2 hours from me. Maybe it is worth driving in the short term. And like I said, the biggest barrier is, of course, the cost. And that certainly is far less a barrier today than it was a year ago.
Well, it may have been more than $80 to fly between Chicago and Tampa a year ago, but it was still very affordable. And this is even before the pandemic. We were at an inflation-adjusted all-time lows in the cost of travel and the cost of flying. And part of that is, and maybe all of that is really robust competition in the travel market. And you've got the big three network carriers, American, Delta, and United. You've got Southwest, which is the, while maybe smaller overall than American, Delta, and United, carries more passengers domestically than all three of us. You got JetBlue. You got significant increases in the role that the ultra low cost carriers like Spirit and Frontier are playing in terms of driving down costs. And so, certainly. There are some incredible deals out there. Once things recover, there, the $80 to Orlando may not be there for long, but we're going to be back. Even when we get back into a more normal place, that there's still going to be really, really affordable opportunities for people all across the sort of income spectrum to travel by air.
And I think, we also, U.S. Travel recently worked closely with a campaign called the Let's Go There campaign, really focused on helping folks to reimagine what it's like to travel and build that excitement and anticipation that comes with travel. And in doing so, ultimately hoping that helps folks push over into an actual booking, right? And I think as noted here, there are really these great deals right now. And I think, if you look, about a year out, there's still actually some really good deals. So, I think to the extent that folks feel ready, and as we've noted, the sort of layered approach to health and safety that the industry's taken, you know, it is something that's great that we have a lot of data that can make you understand, you know, how happy you really are when you planning that trip. I know as someone who just recently, you know, took 2 trips, it really does make you feel alive and excited and happy, and you can do it in a confident way if you follow all the health and safety guidance that's out there.
Great. Well, I think we should wrap it up on that high note, because obviously this has just been such a trying time for these industries. And as you mentioned, they do give us so much, not just in practicality, you know, moving around for business, but for that vital element of our lives to see something new and meet new people and absorb, you know, America's heritage as well as internationally. So we obviously are watching and hoping for even more recovery, and hopefully quicker than we can imagine. So I'll just mention to the audience, to all of our viewers, that as our exchange work here at ACYPL transitions to virtual engagement during COVID-19, it is vital still that we measure the impact and effects of things like these virtual town halls. So we ask that you complete a brief survey. If you're on Zoom, you'll get a survey link via email. And if you're on Facebook, you can find, or on YouTube, you can find the survey link in those video descriptions. So we really appreciate if anyone can take time to go ahead and fill those out for us. Again, thank you all so much for making time, especially Michael, on your birthday. We hope that all of us had just one COVID birthday and that is it. The next birthday is going to be much better. So to our speakers, thank you so much for joining us.
Thanks so much.
Thank you. Keep up the good work.
Yeah.
Thanks, ACYPL.
Bye, everybody.